because this patient had been treated extensively. She had the initial doxycycline treatment, which resolved her symptoms for about 2 years. She did not have another known tick bite or exposure, and started going on a downhill path neurologically after about 2 years of her diagnosis. And then she was treated with IV ceftriaxone, amoxicillin, and did show a fair amount of improvement, but then later developed symptoms and signs of dementia, among other things. And so my suspicion is that the physician probably, ruled everything else out. And we know that that's the case because of all the tests that were run, and then just basically treated her as a dementia or Alzheimer's dementia patient. So now we're very interested in looking more at Alzheimer's dementia and Lewy body dementia patient autopsy specimens for the presence of Borrelia. This is not a pathogen that you want to have in your brain. You don't want to have pathogens in your brain, period. But we found a nice, beautiful intact spirochete in her spinal cord, and we were able to find DNA evidence in the brain. And, we've seen we've had similar findings in our non-human primate studies. So Borrelia can definitely enter the brain and persist in the brain.
I have ongoing leg pain. And this area on my leg is always either tingly or just painful, always. And then I started experiencing numbness in my hands, and that it would be intermittent. Now it's a lot more often. Those two things are the two top things that I experience on a day-to-day.
It doesn't go away?
No, not yet.
Still, there's good days and bad days, I guess.
Good days and bad days. How many times a day am I getting numb versus not numb?
But you do believe that whatever you got infected with, that when the spirochete entered your system, it did go to places to affect you, like either with the fatigue or the tingling and different things like that, right?
I think so. I mean, there's no other way to explain the symptoms that I have.
I mean, especially the depression, the other things you were experiencing too, right?
Right.
Psychologically.
Right.
Is there anything new with your prognosis and treatment since we talked to you last time?
So the last time we talked, I was doing better.
Right.
And, the things that were really low were now a little higher. And I had blood work a few months ago, and all of it came back looking pretty good. And the Lyme disease, the teeters, they look really good too, which means that it's either gone or at bay. Unfortunately, the Epstein-Barr virus is, spiked again. So we have to work on that.
Are you doing any type of regime or protocols right now? Just like you said, you want to take care of your health better and do more things for yourself?
I do want to do more things for myself. I think that I haven't been as attentive to myself as I would like to be. I'm on a lot of different supplements right now. No drugs, just supplements, and I'm fine with that. I believe in the supplements. I believe that they help. I think that they're something that I need to take in order to get myself to where I need to be.
Were you on a course of antibiotics as well? You were, right?
Yeah.
Right.
Yes. So what happened was, during my time with the naturopath, I decided that I heard about another doctor, a more conventional doctor, that was an infectious disease.
That's right, yeah.
And she was so close to where I live, I decided that I would investigate that as well. And I was a little concerned not having two doctors per se, but having two doctors from different backgrounds. Like, how is all this going to work out? And are we going to be butting heads with treatment? Because it's two different mentalities on healthcare. But I went to see her, and I really liked her, and I liked what she had to say. She took me seriously. And I decided that I was going to work with her too. And I told him that I would be working with her, and I told her I'd be working with him. So to answer your question, yes, she put me on a protocol, and I've gone through almost the entire protocol. There's one drug left. And I'm, just trying to decide if I'm going to go that route or not. But the interesting thing about this is this. I make sure that I schedule both doctors in the same week. And they don't know that I schedule them in the same week. And I'll go to one doctor, and then I'll show up to the other doctor, and I wait to see what they're each going to say. And almost always, they say almost the same exact thing. And it's been so cool that they're not conversing with each other, and they're not, saying, oh, don't go that or don't do this, because of the different mythology, but they both agree on treatment. And it's been excellent, or diagnose for that matter, when we're looking at the blood work and those kinds of things. I think it's important for people to find a doctor or a team that resonates with them. If you can't be open with your doctor, and if you don't feel as though the doctor's responding to you, it's not a good match. You have to be able to find that.
And it's a constant journey. You have to take care of yourself. You have to keep up with everything. And patients need to realize that's going to be part of their life, unfortunately, unless they're really fortunate that it's completely dormant and doesn't get active again, because I guess it does stay within your body, right?
It does stay within your body, although there are some doctors that think it can be completely eradicated.
Yeah.
So, it depends on what you yourself thinks and feels.
Right.
But it is ongoing. Your health is ongoing. You need to stay on top of it.
Right, exactly.
And I think that goes for anybody, whether you have Lyme disease or you're just a healthy person.
It's universal.
Yeah, it's universal.
So tell me, you say you try to keep up with a lot of things, and it doesn't mean you can be on top of everything, but just reading the article I came across that they're doing this really incredible research, Tulane and Columbia, to try to find out how pervasive the spirochetes are that causes Lyme, and the fact that you're not the same person as this woman, but that she had couple similar symptoms. She did have dementia. She was treated for 15 years. Doesn't mean you were going through the same treatment. But what did that article, was that kind of a surprise to you, or is it something you thought, this is possible based on what I've been through? It's probably attacked my central nervous system to make me feel this way, and the brain controls that. So what was your reaction?
The first reaction was the article scared the hell out of me. It really did, and it made me upset.
Did you read the report?
I read both.
Okay.
Yeah, and I just thought, this could happen to me. This could happen to anybody. Am I doomed? What's my future going to be?
Why was that first reaction? Is just because to see this published research, so pretty definitively say this is what we found, and the caliber of experts that are looking at it?
Yes, I think that's it. And then just knowing that this is possible. This is absolutely possible.
That it's found in brain tissue.
Yeah.
Despite treatment.
Yes. But then again, in the back of your head, what did you really think? If you're experiencing these kinds of symptoms, then of course it must be, attacking some part of your body. I think just seeing it in print like that makes it more, more there.
So it's a double-edged sword. It kind of makes you pause and think, what about me? But also the fact this is published researched, very respectable. This is the neurologist publication that other neurologists look at, and they look to. It's like the New England Journal of Medicine, right? So you have this great evidence, research-based evidence going out there to the public, to the providers that are taking care of patients like yourself. That's really important that it comes out, right?
Absolutely. I think whether it's good news or bad news, it needs to be out there. People need to be informed. Doctors need to be informed. Doctors need to have a light under there to get them going. There needs to be more research on this.